Today's presentation is about Dorothea Orem's self-care deficit theory. Orem's theory's goal is to encourage self-reliance using three main theories: theory of self-care deficits, meaning patient or family are unable to provide patient needs, and theory of nursing systems, when self-care demand exceeds self-care abilities. Theory of self-care is divided into three parts: self-care, meaning activities that individuals perform that contribute to their health; self-care agency, meaning patients' ability to meet these requirements; and therapeutic self-care demand, the totality of actions needed to be performed in order to meet self-care requisites. I will now present a practice scenario relating to community health nursing. We received a referral today for patient Mrs. Z. She's discharged back home from the hospital as a newly diagnosed diabetic with the goal of diabetic health teaching. As a community health nurse, we'll review her care plan, conditioning factors, self-care deficits, abilities, and systems. We're going to include specific teaching on managing her diet, blood sugar readings, blood sugar ranges, how to use her insulin pen, and signs and symptoms of hypo and hyperglycemia. Her basic conditioning factors include that she lives in a safe neighborhood in a rural area, Indian cultural background, support system of family and friends. She has hospitals and clinics nearby, has to go to a larger city for specialized care. She's low income, 66-year-old female with hypertension, COPD, anxiety, and depression. After our visit today with Mrs. C and using the nursing process, we reviewed step 1, that she is aware how to use the glucometer and read her sliding scale, though she is unsure how to administer her insulin, where to administer, and that she has a fear of needles. She states that she understands her diagnosis and wants to become more independent. We know that she's physically capable as she is mobile and able to provide the injection, read the glucometer and sliding scale. Step 2, we will then plan a delivery of care to overcome her deficits, and we will provide nursing actions needed. Step 3, we will then provide the care plan and evaluate the efficacy. We'll return in 2 days, evaluate her blood sugar levels, where she injected her insulin, and her diet. We'll then make modifications as needed, make a referral to diabetic clinic if she's still not fully understanding her health teaching, and we'll refer to a physician if her insulin dose is not sufficient. Using the theory of nursing systems, we know Mrs. E is under partially compensatory, as she does require nursing assistance to give her insulin. We'll then move to a supportive educative role where she's independent in her care. Presently, I'm meeting with Dorothea virtually via Zoom in our prospective offices, and we're discussing how to improve nursing practice today. So, Dorothea, today I have a newly diagnosed diabetic, and I'm just wondering if you could answer some questions for me about how your theory can address my client's needs. So, my first question to you: how does your theory relate to community health nursing? And I'm asking because this is my current practice role. Dorothea would then answer, this theory promotes self-care, assists in health teaching, assists clients overcome deficits, and allows us to understand referrals that are needed with the same goal of self-reliance. Secondly, I'd ask, Dorothea, how does your theory relate to encouraging independence in healthcare needs? I'm asking as my role is to promote independence for clients to ensure they are safe and well to stay in their own home. Dorothea would answer, my theory encourages individual care plans, self-care, it follows the nursing process, and allows the nurses to assist as needed. The question I have is, how does your theory support cultural values and beliefs? The rationale for this question is because Mrs. C is from India, a different cultural background compared to my practice in Canada. We know that self-management through cultural beliefs affects quality of life. Dorothea would answer, this model does not specify cultural beliefs or values. Finally, I would ask you, Dorothea, how does your theory support clients with mental health concerns that may affect their ability to provide self-care? The reason I ask this is because Mrs. C has anxiety and depression and has a fear of needles, and I'd like to know how to best utilize this model in a care plan for my patient. She'd then answer, this model does not include a mental health focus as it is mostly based on physical health concerns and their illness. Thank you for listening to my presentation.